Welcome to the Physician Associate Podcast.
Welcome to this very special episode of the RCP Medicine Podcast, where we're joining forces with James from the Physician Associate Podcast. I'll hand over to James to introduce us.
My name is James, and I'm really excited today to bring you this special episode, which has been produced with the assistance of the Royal College of Physicians. I'd like to welcome my guest this week, Dr Laura Gordge, who's a Clinical Education Fellow. Welcome to the show, Laura.
Hi, James. It's really good to be having a conversation with you.
Do you want to start by telling us a little bit about yourself and your history with Physician Associates?
Yeah, definitely. So, as James said, my name's Laura. I'm working with the RCP for a year as a clinical education fellow. I, in my normal time, I work as a palliative care registrar. So I'm in my fifth, ST5 year of specialist training. So I'm taking a year out of training to work with the RCP on a number of different projects, and have become more involved with a recent one involving the Physician Associates exam and creating a revision aid for that, which I'll talk in a bit more detail about later on in the podcast.
Perfect, thank you. So one of the things that I wanted to make a podcast episode about was the Physician Associate National Exam and how PAs can prepare and study well to pass that exam. Is there much knowledge about the PA National Exam, do you think, amongst some of your doctor peers and within the wider sort of educational community within the RCP?
I think in the doctor world, we're still getting used to and understanding more and more about the physician associate role. I think more and more of us are working with physician associates in our everyday work in lots of different settings. I know I've worked with physician associates in ITU, in acute medicine, and I know there's quite a few in GP land as well, isn't there? And I think in terms of the assessment, we don't have a huge amount of knowledge of what the exams look like, and certainly something I've been learning throughout my involvement with the physician associates is that there's a lot of overlap. There's a lot that we do have in common in terms of our assessment and our examinations. And that's really helpful to know, I think, because that helps us understand your role, your expertise, what you can do alongside us.
Yeah, absolutely. I think that's a really good point. There isn't an equivalent national exam for doctors, is there? It's not like every doctor sits the same exam in the UK.
No, that's right. All medical schools have their own finals, which is the sort of exit exam after all of your medical training. There is now a national prescribing exam. That's something that's come in the last few years. But everything else is very much set by the medical school, according to a GMC protocol and that they have to review it as well. But there's not something in the same way that there is for the PAs.
So I think in the PA world, obviously, at the moment we're unregulated, but the GMC are going to become our regulatory body as well, and will set the standards for education. It's true that PAs have to sit their finals or their exit exams of their university course at the moment. There's also this extra layer of nationals for physician associates, which is similar to how it's done in the States as well for physician assistants in America. Nationals are sort of two parts. So there's an OSCE national, and then there's written papers, or actually they're online now, but question similar exams like that.
Yeah, that's interesting that the exam is all done online. I find that kind of hard to get my head around. How do you know people that have gone through that process and how it's been for them?
Certainly, yeah. When I was a PA student, and that sat my nationals only 3 or 4 years ago, it was paper exam, as we'd all be familiar with. It's only, I think, very relatively recently that it's moved to being an online exam with software that watches you on your webcam as you do the exam on your screen to ensure that you're not cheating. And I think it's, I guess, better for the students because they don't have to travel down to examination centres across the country to do it, and probably more efficient to run an exam with several hundred people at a time using their own devices. So the national written part is two 2-hour exams, each that have 100 questions, and they're each single best answer. It's sort of format, so you get the question stem and then 5 possible answers, and you have to choose one out of the 5 that it's the single best answer, they call it.
Yeah, they can be quite tricky. I think pretty much all of our exams are the same, and you can often wheedle it down to 1 or 2 or 3 answers perhaps, and then working out the difference between them can be hard. It's definitely a technique.
Yeah, I was going to make the same point. Definitely took the words out of my mouth. It's certainly a way of learning how to approach those sort of style of questions, isn't it, that can help students become more confident and score better in the exams, definitely. One of the things I noticed that when I was a PA student, there weren't an awful lot of PA exam questions, past papers, mock exams, resources to use to revise. So we ended up using online question banks that were designed for medical students and med finals, which may not have been that dissimilar, but also weren't really tailored to PAs. I think that's something that the RCP have picked up on as well, haven't they?
Yeah, definitely. We've recognised that those resources for PAs revising fall far short of that are available for doctors at a similar stage. And like you say, I think a lot of PAs do end up using medical school textbooks and question banks, which, as I said before, there is a degree of overlap, but the level being designed for PAs is obviously not quite right. So there's been a large project at the RCP, which I've been very fortunate to be a part of. It's been going on for some time. I've kind of joined it partway through. Lots of others have done some really good work getting it to this point. And essentially it is building a revision aid in the form of a question bank. So over the past year or so, people have been submitting questions and trying to build up a large enough number in order for it to be a useful resource, and that's been quite a challenging process. It's something we really want to get right, and we have very high standards to achieve. But we are coming towards the final stages of that process, and there will be more information coming out from the RCP about how you can access that resource in the coming months. As I said, it's not quite ready to launch just yet, but we are definitely approaching those final stages, which is really, really exciting. But we are at the stage where we need more questions, and we would really value more question writers as well. We've got a fantastic team at the moment, a mix of PAs like yourself, James, and then quite a lot of doctors as well. So people in their training like myself, and also some consultants and community specialists as well, just recognising that your curriculum and the various areas that you're tested on are not exactly the same as physicians, like kind of hospital doctors. So we've got a good team, but we could always use more question writers and people to submit questions.
Oh, brilliant. Yeah, it's really exciting to hear that the RCP are producing this resource for physician associates that will be sort of tailored at the right level. Mm. What makes a good exam question, do you think, when you're writing for this sort of resource? How do you construct an exam question that works well?
That's a really good question, one I've been asking myself quite a lot as I've been getting my head around question writing. I think it's really important to have a good structure. When we think about an exam question, we're not thinking about just the question and the options. There's different parts to it. So for the PA national exam, we've really modelled the questions we put in our question bank on that framework. And again, that's information that's out in the public domain. So we're not using any special insider information. We're just using what you guys have available, so that we make sure our questions represent those questions that you're asked in the exam as well. So what they always begin with, and again, this is the same for doctor medical exams, is kind of a clinical vignette. So-and-so comes to the A&E department complaining of these symptoms. This is their background. And we call that a STEM. That's the kind of overarching clinical picture. And that's supposed to represent general clinical life. The scenario should be one that you could be faced with in everyday practice. So obviously wanting the exam to reflect that real clinical practice as well. So you're given that that's STEM. And then off the back of that STEM is a question. So that question might be, what is the most likely diagnosis? What investigation? What test would you like to do off the back of this information that you've got in front of you? And all of those options need to be plausible. You can't have someone's got chest pain and one of the options being attacked by a bear in the forest. It kind of is tempting to come up with something a bit ridiculous sometimes when you're struggling to find an extra thing. But the options list always needs to be ones that are possible that you could come across. So it is a real art, and it's definitely one I've got wrong at times when I've been writing questions. So in the RCP question bank team, we've got some approvers who look at all the questions that are submitted, and they will give feedback based on your question and whether they think it's one that's good enough for the question bank. And we always aim for that feedback to be constructive, so that as a question writer, you learn how to make your questions better. And once you get into the rhythm of it, it's something anyone, I think, can learn, and it can be very satisfying as well.
When you're crafting those sorts of questions, they don't put anything in the question that is sort of superfluous or irrelevant, do they? So if there's mention of you're seeing this patient in general practice or you're seeing this patient in A&E, that sort of is a clue, isn't it, as to perhaps the type of diagnosis or question that they might be leading you down to.
Yes, every single piece of information is really key. That's often a piece of feedback that we give to question writers. This piece of information, so sometimes even past medical history doesn't help the candidate to get to the right answer. So every single thing that's in the question, I'm fairly confident this reflects the actual exam as well, is information that will be helpful.
One of the things I remember being sort of told about these style of questions is to try and cover up the possible answers and just read the STEM initially and think, okay, what am I expecting to come up? What is the most likely diagnosis in my head? And if it's there in the list, that's probably your answer you consider first. Yeah,
that's a really good good thing to do. And again, it's part of our question writing. The way that we write questions is we want it to pass something called the cover test, which is exactly as you describe. It's looking at the question and the STEM and not looking at the options list after that, and making sure that someone could answer that with all the information given. Because the risk is otherwise it becomes more of a true-false question rather than a single best answer. It's finding, you end up looking at all the different options and working out which one is correct rather than using the clinical information in the STEM, which is obviously what we want people to be doing.
In the STEM of the question, you're obviously going to be including information about the patient's sex, age, background. Is there a sort of bias or a implicit sort of worry that you sometimes reinforce some stereotypes negatively or get things wrong with those sorts of questions?
I think there's a growing realization of how in medicine in general, both in the assessment zone, but also in textbooks and other kind of medical materials, we have definitely been guilty of unintentionally, but reinforcing nonetheless some of those stereotypes. Again, that's something that we are very aware of, and we do look carefully at all the kind of extra information that we're giving in our question stems when we're writing for the revision bank. I guess it's that growing awareness, isn't it, that we're all trying to be more careful of and more understanding of. But that's a really good point to make, and one that we're definitely taking forward, but we certainly don't always get right, and it's another thing that we would really value. I think the more authors that you have in this setting, and particularly from lots of different backgrounds, we're going to be better at realizing when we're doing that, particularly when we don't mean to be.
Are there things that students sort of get wrong, or types of questions that people always stumble over that they can learn from or improve?
That's a tricky one. Do you mean when we're writing questions or when we're sitting them and being assessed?
Yeah, I guess both. What trips up the question writers and what trips up the students?
Yeah, I think getting speaking from a question writer's perspective, I think getting those options, the options list right is a real art. So as a question writer, as part of the question bank, if you reach 8 questions that you've had submitted and accepted, that's when you're invited into the approver group. And there's support at every level for this. And I have recently started being an approver and looking at a lot more questions myself. And that's probably the area that I try and give the most feedback on, because I think finding a balance of making a question difficult enough to be challenging and that you actually learn from, versus making it really easy and just making people feel good about themselves, but actually might not be helpful for passing the exam. It's quite difficult to find that. And I think, again, it's the kind of thing you only get better at by doing it more and more, and by seeing more and more questions, and particularly seeing questions from PAs who sat the exam and know what is expected of them. That's probably the trickiest bit. And then what you were saying also before about having the right relevant information, not making it too long, not making it too short. That's another area that I think is tricky, and one that people need to learn by doing and getting some feedback on. I'm not sure about questions that people tend to get wrong, because I haven't. Obviously, I'm very, very separate from the national exam itself. I have really nothing to do with that or the marking process, and we don't use feedback on the real exam either to guide our question. We're very much just driven by the curriculum material and what we know about the makeup of the exam. I guess the temptation is always to revise really, really well the areas that you know are going to come up in the most frequency. And that makes sense on a number of levels, doesn't it? So I know that I think cardiology and respiratory problems, both in the community and the inpatient setting, are really common. So people will tend to focus their revision on that and leave maybe the ethics and safeguarding and the questions that are both hard to revise for, but also are going to come up less. I think it's easy to neglect those areas, but then they are still very important. So I guess just being aware of that and planning that into your revision is a good move.
Apart from again, this might not make the episode if there's not a good answer to it. Apart from using the online question banks to revise, is there any other sort of techniques or resources or other ways to learn that you would recommend for people, PAs or doctors who are taking exams?
Yeah, so I've asked a couple of friends about this, because I think the first thing to say about preparing for exams is everyone is very, very different, and there is no one set way, one route that will lead to success. I think we are all such different learners, and it's one of my friends I was asking was saying, is this for medical students or that you're talking about, or you're talking about in the postgraduate setting? So when you're both working and revising, I think that's a very, very different prospect, isn't it? When you've got the pressures of clinical work and the exhaustion that comes with that, and then you've got to sit down in the evening and do a whole load of work. And I think regardless of that, there's a couple of themes that seem to come up whenever I speak to people about preparing for exams. The first is planning. As we talked about earlier, it's easy to do the topics that we like and the ones that we feel confident in, and neglect the ones that we either don't feel are that important or we know that we're not that interested in. Or whereas if you say, on a number of days, I'm going to do this topic, making sure that if you do stick to that plan, then you still have got some wiggle room at the end, in order before the exam to make sure you consolidate that knowledge as well. I think certainly for me, that's a very helpful technique, because it helps me calm some of the anxieties that comes with exams, knowing that if I'm able to kind of do this much each day, or if I know that this plan will make sure I cover everything in the curriculum, then I should be all right. And then alongside that, I think being realistic with your planning as well. So I remember at medical school trying to revise for kind of 8 hours a day with 5-minute breaks every so often, and it was completely impossible and unrealistic. Whereas I think as you get older, you realise what's the length of time I can realistically concentrate for. Plus, adding in the fact you don't have the luxury of all the days that you have at medical school or in your university studies to do that. So planning's one thing. I think if you're a visual learner and you like writing notes, definitely do that. I remember living with people who had post-it notes everywhere, on the mirrors, on the fridge, just with all those little facts that you just have to learn. They have to be in there, and they have to be within reach on the exam day. But I think you have to be aware of writing notes for the sake of notes, and I've definitely done that before, where you end up writing out textbooks and rewriting notes that you've done from lectures, and it feels good. It feels like you're doing something, but you always have to be checking that is going into your head and into your mind. And question banks and past questions is definitely one way. Another way that I know lots of people find helpful is having revision buddies, having a group that you do meet up with periodically in order to check your knowledge, maybe teach each other certain topics. So if one person really likes obs and gynae and you really don't, then that's great to kind of work together. But again, always just being wary of that comparison that we're all can so easily do, and that can leave us feeling worse if we're sort of saying, oh, so and so much better than me in this area. There are people that are helpful, and there are people that are maybe not so helpful, and surrounding yourself with people that challenge you but also support you, that's really key. Is there anything that you found helpful in your years of assessment?
Yeah, absolutely. A lot of the points you were making, I'm nodding along to, going, yeah, that rings true for me as well. For me, I think it's spaced repetition. So picking up something one week and perhaps getting the answer right doesn't necessarily mean that it's going to convert to a long-term memory and I'm going to remember that knowledge 2 weeks down the line, a month down the line. So it's about revisiting the same topics and building up knowledge and actively doing something about it, rather than just assuming, well, I knew it once, it will stay in my brain. Because if we don't use it, we forget quite a lot of what we've ever learned and what we've known without applying it properly. So I think definitely spacing out and repeating topics are really important to make sure that you're converting that sort of short term, okay, I remember what that lecturer taught me this morning, into long term, I've actually got it in my memory and I can use it and recall it when I need to, is really important.
It must be quite difficult, because I know you guys have to recertify with your exam every 6 years. And I guess if you're working in one setting, for example, GP, revising all, because my understanding is the exam, it's a set curriculum and it keeps you as a generalist. So how do you plug those gaps when you're not working in that area?
Yeah, it's a really interesting question. So yes, as PAs, we have to basically take our national written exam every 5 or 6 years to recertify. So it's basically like taking finals again, 5 or 6 years down your training. And if you're like me, I'm a PA that I work in general practice and I work in acute medicine in the hospital. So I have stayed quite general. So hopefully when it comes to me recertifying, a lot of it will be familiar from my day-to-day work. But I've got PA friends who have specialised in obs and gynae or cardiology and may never have thought about paediatrics or a rash or those kind of things. So it will be difficult for some PAs to specialise. I don't know whether that's the best test as well of physician associates' generalist skills and whether that's going to be in place in the future for the profession. I quite like the idea of remaining as a generalist as a PA, but I know that of the PAs won't want to do that exam, and is it right that they should have to face an exam, and if they don't pass it, what happens to their job? And there's all sorts of questions that I think the GMC are working through as part of the regulatory process, and what form that takes in the future is sort of not decided at the moment. But online question banks and this RCP question bank will be a great resource to help PAs cope with that whilst it is in place at the moment. One of the pieces of advice I would give is, as you're getting towards your finals and your national exams, is you do need to be aware of that time constraint, and you do need to be practicing under exam conditions and timing yourself, because if you run out of time and you don't answer all the questions, there may be 5 questions at the end of the paper that you know all 5 answers to, but if you spend 10 minutes stuck on question number 95 and never get any further, you're not going to give yourself the best chance. So I guess one of the techniques I would advise is, if you don't know the answer, you really don't know it, flag that question, come back to it at the end if you've got time, but do the questions you can do first. And talking from experience, I will put my hands up and say I failed my second year university PA exam the first time round. I wasn't prepared well enough. I'd been going to placement, I'd been doing all my hours of revising at home, but I don't think I'd been revising well. I'd just been sort of passively reading books and maybe copying bits into notes, but not really using the knowledge, not really applying it properly. And I certainly hadn't been using online exam question banks and those kind of things.
I think when people do fail, for example, PACES exam, and that's the clinical OSCE that doctors do if they're in IMT training, which is the kind of medical training and the step up to becoming a medical registrar. That's a really common exam to fail. Sometimes it's preparation, sometimes it's just on the day you don't perform as well as you know that you can. All the cases that come up are really tricky and not ones that you're so comfortable with. And very often people will immediately rebook and aim to resit that exam as quickly as possible, kind of holding on to the preparation that they have done for the original exam. But I think it is also important to take some space before diving straight back into the revision and the preparation, kind of attending to those emotions and those feelings that everyone has after they fail, and understanding the failure not as a kind of an issue that is something, a problem with yourself, but trying to identify the areas where you have got weakness so that you can be constructive with your preparation next time.
Absolutely, yeah. I can remember after getting the news that I'd failed the first time, it was just before Christmas. And I was just like, right, that's it. Christmas, New Year's is cancelled. I'm miserable. I don't want to be festive, etc. But it was really important to just have that break mentally and say, okay, in the new year, I'll pick up afresh. I'll start revising again. I still want to really do it. I'm still determined. And it was just important to have that mental headspace initially to sort of come to terms with the fact that it wasn't the end of the world. It's totally fixable. You can, if you're determined and you put the work in, you can pass second time. I don't think there's anything more I had prepped to talk about. Was there anything that we ought to cover?
No, I think we've had a good conversation on lots of different topics. I guess just one more plug, if I can, for the RCP question bank for PAs. As I said, we welcome authors from a wide range of backgrounds, so doctors, PAs themselves, any stage of doctors as well, so from foundation through to consultants. Having that wide range of expertise can only make our question bank better. I guess the only caveats we do have is we don't ask PA students, so if you haven't finished your training yet, if you haven't passed the national exam yet, we ask that you join our team once you have done that, and the same with medical students as well. I mean, it is the postgraduate doctors that we're asking to be part of that. And just as some incentives, there is training at every stage. So as a new author, there's a CPD accredited course that you can sit online. There's also a number of training videos going into a bit more detail about the things I was talking about earlier, the question stem, option list, the types of questions that we want in the question bank. And then there are incentives. So as I said, you can become an approver if you get 8 questions submitted and approved. And we still want you to write questions if you're an approver, but you'll also have a role with providing feedback. So if you are interested, we will put a link in this podcast description, which will bring you to a sign-up page so that you can get in touch with us and we can start you on your question writing journey.
Perfect. Thanks, Laura. Thanks for explaining that all. And I would really encourage any PAs who've listened to this, or anybody really who's listening to this who's eligible, to get involved with helping to write the questions. The more diverse sort of background of people that we get writing these questions, the better the quality of the product in the end, isn't it? And like you say, I'll leave a link in the show notes so that if people are on the Physician Associate podcast feed, they'll be able to find the link through to the sign up for the RCP question banks there. and it'll also be in the RCP podcast feed version as well. Thanks so much for joining me.
Thanks very much.
Thanks for listening to the Physician Associate Podcast.